When Jody first came in, she had two problems. The first was knee locking. So when she would sit for long periods of time or go from sit to stand, she was having difficulty because her knee would lock and she wasn't able to move it afterwards. That's commonly caused by degenerative joint disease or a problem with the meniscus or the cartilage. The second problem that she was having was difficulty turning her neck every time that she would turn to the left, and she was compensating by turning her whole body. That's commonly caused by degenerative disc disease or stenosis, or more commonly it's known as arthritis within the neck.
I'm involved in two different charity hockey games. One is a police benefit hockey game in December for families of officers killed in the line of duty. With this injury, I had only 2 weeks of physical therapy prior to the police benefit hockey game the first weekend in December. So when I came in and first met with Dr. Jen, I looked at her, I said, well, how aggressive are you with this? And she said, what do you mean? I said, you have 2 weeks. And I said, you have 2 weeks and 1 day, actually, it was on a Friday I met with her. So I said, you have 2 weeks and 1 day to get me back on the ice. And I told her about how important this game was, doing it for the families of these officers killed. You know, we've done it every year, and it's good for the families, it's in support of the families. I mean, they just lost, you know, their husband, father, whatever. And so it's very important for me to be a part of that game.
When a person comes in on day one, we test where they're at right now. We also ask them, where do they want to be? So not everybody has the same goals. Some people want to return to playing hockey, like Mike. Some people want to play with their grandkids sitting on the living room floor. We can help with both of those goals, but it starts, where are you at today? Where do you want to be? And then we set a plan according to that. So in Mike's case, he was pretty aggressive, wanted to accomplish a whole lot, wanted to be able to play hockey, which involves a lot of shoulder movement and a lot of stability and strength in the shoulder, and he wanted to do that in 2 weeks and 1 day.
Well, I had a relative that came to Madden, and I said, yeah, I said, I'd like to go to Madden Physical Therapy. I said, I understand that they do really good stuff. So she wrote a prescription for me, and I came, and the first day I was here, the first day I came, I walked with a cane, I had a walker in the car, and you would have thought that Methuselah had nothing on me as far as years go, because I came in here like a little old lady, hunched over and shuffling. And I'm not old enough to do that.
When we take a look at somebody who has a history of falling, there's one of 3 systems that are being affected. In Joan's case, she had a stroke, so we know the system in her body that's most likely not working the way that it's supposed to. Unfortunately, in her case, she began to compensate in her day-to-day movements, the way that she was walking, and she was actually looking down, watching the floor as she was walking, and watching her feet because she didn't want to take a false step or a wrong step and end up falling again. So the therapist, as she was working with Joan, encouraged her to look up.
My knee took a little bit of work, more work. The staff at Madden was so patient and so pleasant, and I know that I was a challenge, but they just kept working with me. They gave me drills to do at home and exercises that could be duplicated at home easily. I would take medications that really I don't think helped. They certainly didn't, the medication didn't help like the exercises did. The stretching and just simple little things like tilting your head a certain way and stretching opened that all up through the neck, and it works so much better than taking a pill.
She took some measurements, and I didn't realize how bad off I was until she did the measurements, especially with, you know, how much, you know, how many pounds of pressure I had with, you know, different ways of moving my arm, and there was just no strength whatsoever. So, I mean, she, you know, worked my butt off, and, you know, so did everybody else, and, you know, got me back on the ice for that game. It was a setback afterwards. When I come back in that following Monday, it was like being back at square one with physical therapy again, but, you know, she did it. She got me where my shoulder was strong enough, and I was confident enough in it that, you know, I can go be a part of the game. Just, you know, things just kept getting progressively better. You know, the exercises got progressively harder. They kept increasing the weight, the repetitions, things like that. And it was, I'm just amazed at how quickly I got back. You know, at my age, I figured, well, it's probably going to be a longer road than what it was. And, you know, it wasn't. You know, things went very well. You know, if something didn't work, they figured out something else that did work. If there's something that caused me too much pain, they figured out another exercise to do the same thing, strengthen the same area, but done a different way, so it didn't cause me the pain. It wasn't uncomfortable. So, I mean, I look forward to coming out here, you know, a couple times a week, you know. And we're not having a babysitter during the day, you know, I bring Sammy along, and, you know, she'd look forward to coming out here too.
I used to love to shop. I used to love to go to the store. So when Dr. Jen said, "What are your goals?" I said, my goal is to go in a store and be able to push a cart to put things in. Not lean on the cart like I do so it holds me up and drags me along. I said, that's not what, you know, if you can just do that for me, that's my goal, is to be able to just say, I can do this. They had thought that it would take like 3 months, but I had such determination because they gave me confidence, they gave me courage, they gave me hope. I looked forward to coming here. I looked forward to coming and doing my program and having them add 1 or 2 things for that particular time when I was here, and they'd say, try it out at home. And I just got better and better, and I mean, they were amazed. The girls used to just say, look at her.
The one thing that we commonly see in the clinic is people will beat themselves up after they experience relief in maybe 1 visit or 1 week and they're doing better, but they've put it off coming in for up to a year or possibly even longer. The simple fact is that we all control our own destiny to some degree, and we can all pick up the phone and schedule an appointment pretty quick. And sometimes we just need a little extra prod to get us up off the couch and make that phone call and take care of the problem.
I work about 25 to 30 miles away from my home, so I do spend a lot of time in the car. And it is very important that I'm able to drive safely. I do have a full-time job, and then I have that full-time ride home. So till the end of the day, I'm tired. I don't always feel like I want to be bothered, especially when I was hurting. But now I can go home, I can do my exercises, I can play on the Wii, I can not think about, oh, it hurts so bad I have to go to bed.
Got to the point where we do an air pack certification every year, where I have to put my air pack on and crawl through a maze and do different tasks. And that's with all the turnout gear and the air pack and everything else. You know, I got 30 pounds worth of backpack on my back pulling down on my shoulders, and then the gear and whatnot. So, but I told her I had that coming up, and you know, that's when the weight started to increase and repetition, you know, reps started to increase. Different exercises to do things different ways, strengthen different muscles, and guys were asking, you know, look, can you do this? Should you do this? I'm like, yeah, you know, I'm gonna try it. You know, I gotta do it. I gotta get it done. You know, I went and did the qualification test and passed with no problems whatsoever.
I'm just so thankful that I have back that independence that I had totally lost and thought that, you know, I could never do anything again. And now, I mean, just today, you heard me say what I did. I mean, I go and go and go, and I think, oh boy, aren't you gonna get tired soon? But, you know, it's not a chore to stand at the sink and do the few dishes that I have, because I'm not leaning over the sink saying, hold me up, sink. The one thing they taught me right from the beginning, stand up straight. Look around at the world. Don't be looking on the floor. Don't be hunched over. Look up, look around. I can do those dishes and I look around and think, do I have anything else I might want to wash here now?
When people ignore the message that they're receiving with regards to pain, numbness, tingling, or they can't move as well as they could before, when they do that, it rarely gets better. Few problems in your life, if you don't truly address the cause of the problem, few problems ever magically get better down here. we can ignore it for some period of time. We can compensate. Instead of taking stairs one after the other, maybe we can take one stair at a time, and we can do that and continue to fool ourselves, but eventually it's going to catch up with us. And many times we'll see people right before surgery, we're the last stop. You know, I wish I would have taken care of this years before, but they didn't, and now we're the last stop before they get surgery or before they get another injection or something along those lines. And they could have eased a lot of their own problems and a lot of their own pain if they would have addressed the cause years ago.